The first talk I already made is about active surveillance, the perspective in Africa. As you know, active surveillance is one of the treatment modality in prostate cancer. And the rationale for this active surveillance is that most of the prostate cancer cases are indolent and they would not cause any impairment to the quality of life and to the quantity of life referred to mortality if they remain untreated. And right now, we don't have all the information that can segregate between patients who need to be treated and not. And active surveillance there is an opportunity to follow up the patient in a window of opportunity for cure, where if any progression occur, you can treat the patient actively without hampering the chance of having good outcome at the long term compared to the patient who immediately underwent treatment. So this is an ongoing process in the developed countries, and the difficulties of implementing active surveillance in Africa is related to the fact that when you have to do active surveillance, you need the patient to have a very low risk status, very low volume of prostate cancer. And as you know, most of the cases we have are advanced. So it's gonna make it very difficult to have active surveillance in Africa right now. But at least we know that active surveillance gives the opportunity to follow up patient and to have more information about the natural history of the disease. We cannot do it at a large scale because the general population of prostate cancer have an advanced disease. But what we have now is more and more men coming for check without having any symptom. They opt to check for their prostate to see if there is something going on without having any symptom. For this case, we end up sometimes having very low risk disease, very low volume of cancer in the prostate, and these patients seem to have indolent cancer, and we can follow them up using active surveillance. That implies a regular visit where we do the digital rectal exam, do some PSA test, and repeat the biopsies just to see if the disease is progressing or not. In windows, as I said, where you preserve the health related quality of life and you don't make the disease progress in such a way you cannot treat them. No, we don't have a screening program, but we have an early detection that are opted by individuals. We are in a consortium that is called Men of African Descent Prostate Cancer that have a whole idea of understanding why we have prostate cancer at a higher incidence in black male. And this is known in the US, in the Caribbean, and also in Africa. So this consortium put together researchers from Africa and mostly in the United States, where you have different centers involved. It is a unique opportunity for us to have all these researchers work together, being involved as investigators, not only providing data and research material, but being fully involved. And right now we are about to start a big grant where we will have more information about the genetic characteristic of prostate cancer in African male. And the whole idea is to have more understanding of prostate cancer at the global perspective worldwide, because we have black male everywhere in the world now. We believe that they are close in terms of incidence and aggressiveness of the disease due to the background of this African American, even if they are somewhat mixed with other ethnic group or other race. But we believe that to better understand why prostate cancer is more common in African American, we need to know what is going on in Africa. We've already have some results that was the base of having this grant, showing that some alleles of genes that are associated with higher risk of prostate cancer are very common among African population, whether they are controls or confirmed cases. So this is just a way to say that we need to understand more at a larger scale, involving more patients and following them up, looking at these markers of aggressiveness through the genome-wide association. This is very important to talk about this MADCAP consortium again, because in the past there used to be collaboration where the African side only provide data and those people in the developed countries make publication. But this time around, we are fully involved as African researchers, and we share everything. We decide on the papers to do, we decide on how to share the data, and this is, to me, a fair collaboration and a very promising way of moving forward.